Greetings, this is Dr. Thomas Dobbs with the Mississippi State Department of Health, and I'm here to give you a quick update on COVID in the state of Mississippi. I want to let everybody know that we are seeing a significant increase in the number of hospitalizations. Our cases have been increasing steadily over the past weeks, but we're starting to see an accumulation of hospitalizations and deaths. Although the COVID pandemic is better, it is not over. You can see that we're having about over 200 folks in the hospital now with COVID. If we consider where we've been over the past few weeks, you can see we've had a steady rise in the number of hospitalizations, and we've also seen more and more folks within the intensive care unit. Mississippi has transitioned in many of the counties to higher risks in the communities. You can see here these that are in orange are showing higher levels of transmission, and we expect to see an ongoing increase throughout the state of Mississippi. Still, a minority of Mississippians have been boosted. In some of the older age groups, you can see that a majority have received their boosters, but still we have a substantial number of folks, even in those most vulnerable groups, have not been boosted. So it's important to consider getting your booster if you haven't had it yet. Things you can do to keep yourself safe during this phase of the COVID pandemic include consider wearing a mask in public, especially if you're older or if you have chronic medical conditions. It's going to be important for you to be safe during this current wave of COVID as it passes through us. Please be sure to get your booster if you haven't had it yet. It's very important to make sure you can actually identify COVID if you have it. Please keep a COVID rapid test at your home for you and your family. These can be ordered at covid.gov/tests, or they can be obtained locally, and there will be efforts through the State Department of Health to provide them closer to your community in coming weeks. Please test for COVID if you are ill or exposed. If you get COVID, contact your doctor or clinic about treatment. Anyone 65 or older or with any chronic medical condition should be considered for treatment with one of these medications, especially Paxlovid, and some of the monoclonal antibodies have been shown to be 90% effective at preventing death or hospitalization. These are treatments that have been woefully underutilized in the state of Mississippi. So please, if you think you have COVID or if you might have COVID, get tested and talk to your doctor or clinic about treatment. Thank you all, and please be safe.